polypharmacy is a big problem that we do truly need to address, especially in older populations. When were these medications started? Why were they started? Are they actually taking those medications? When we look at our list of medications that we use, really considering what are the side effects.
So explain to us, what is a pill burden?
With a little health and a little wealth and a lot of love, that's a life that we live. Suits and Scrubs.
Hello, everybody! Welcome to another episode of Suits and Scrubs. I'm your co-host, Zachary, SVP. With me, I have Emily, MD. She's double board certified in internal and obesity medicine. She's also exploring functional medicine as well as aesthetics. Fun fact about Emily, she likes to eat sugar bread. So last time we did this episode, this podcast was a few nights ago, and we had a few drinks. It's like our date night. This is the podcast you come to have date night. We have wine here. Great 3-day weekend this weekend, and we had a little bit. We did a shot before the episode, which we don't normally do. And I swear we're not drunk while doing these podcasts. Well, maybe sometimes. But in the night, she made sugar bread, which she put butter on bread and sugar and that much honey. It was funny to me. All right, to you, Em.
So I am joined by my co-host, Mr. Zachary, SVP. Thank you for that wonderful introduction. He is our finance guy who does our wealth episodes, but he also has a lot of accomplishments. He reached his Coast Fire number, which if you don't know what that means, you'll have to go back to some of our prior episodes, specifically episode 2, to learn a little bit more about what that means. He has also managed over $1 billion to date. And fun fact about him is that he is wearing cowboy boots right now. And it probably gives him an extra 2 inches of height, which he does not need, already standing at 6'6" tall.
Yeah. Well, if you guys are not watching us on YouTube, I'm wearing my Canadian tuxedo. Mm-hmm. A Canadian tuxedo is denim on denim. On denim on denim on
denim. Denim on denim on denim. Denim, denim, denim.
Denim, denim, denim. Woo. Okay. Before we jump into our episode, we always talk about an IVF, a side story, which is IVF, and then Akkermansia. So we are planning to price out the Akkermansia supplementation. We talked about this last time. We looked at our budget, and we did a 30-day challenge, so we have to do it. But Emily wants to do it to test a before and after. So we're just going to do it all together. So we'll let you guys know and stay tuned. No new updates on IVF. We are going to do a second round after St. Patrick's Day. St. Patrick's Day we always reserve for us. That's actually where we fell in love, is during St. Patrick's Day.
In Savannah.
Yes, so we don't want to taint that with no drinking and all that. We want to do some debauchery. So that's a little bit of our side story. The second one is speak at your own risk.
Speak at your own risk.
In this segment, we created a wheel of punishment.
So don't say the word.
You don't say the word.
Or we'll have to spin the wheel.
And do the punishment. Emily lost last time, but I did lead the witness on that one. I really did.
It was a little bit unfair.
It was a little bit unfair.
More than a little bit.
It was, but I will make the rhyme easy. Since the word last time was wine, wine is your word. Dun, 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 dun. Do, 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 do. You have enough time? Wine.
I
Wine's
didn't
the
know
word.
I was doing the rhyme this time, but okay.
Yeah, because you got a punishment last time.
So we are drinking wine, and I am having to rhyme with an unfair word battle that is taking too much time.
Well, that didn't rhyme, so. All right, maybe we'll try next episode, so I'm not letting you off the hook. That wasn't your best work. Although last time was pretty good.
I was caught off guard.
All right, so let's talk about the title of this episode. Do you want to tell us what we were talking about today?
So today we are talking about something called polypharmacy.
But what's the title of the episode?
The title of the episode is a doctor explains how to minimize pill burden.
Yeah, so pretty much all the pills, like should you do all the pills? So let's minimize. See, that's part of what we do here at Suits and Scrubs. We are very interested in empowering you guys, ask the right questions, and to increase your quality of healthcare information. So we want to start out with our first segment, which is our more popular segment, which is Refactions. Refactions! In this segment, we'll be reacting
And fact checking.
on viral content. Get it? Refactions! All right, let's play it.
My parents were spending the night. These are her nighttime drugs. And this is his bag of drugs. And then we have different things for the morning so we can golf and not hurt. That's,
Or have heart attacks and die.
or have heart attacks. That's the dog. Wow, Jesus. Do you take all these? Mm-hmm. Wow. And you know what? By looking at them, you wouldn't know it. They don't look like druggies. They're pretty healthy.
So I counted the bottles actually when the YouTube was playing, but the one that she was showing is like 12 to 15 bottles of pills. I do not, like I take a supplement every day, but I do not want to be a slave to pills. So what is your reaction to, or refaction to this short? That was a good one.
Yeah, so I think this is something that we see a lot in medicine. It is not an isolated incident. We can first talk about a little bit of the specifics and statistics. So according to the CDC and the National Center for Health Statistics,
What's TDC?
the Center for Disease Control,
Got it.
49% of the U.S. population have used at least one prescription medication within the last 30 days. So half of our population has used at least one prescription med within the last month.
Yikes.
24% have used 3 or more within the last 30 days, so 3 prescription medications.
It's like 30%. That's almost 1/3.
Yeah, and then 13% have used 5 or more. 5 or more,
10% of our population.
over 10%. And then this is another staggering statistic. So 54% of adults older than 65 take 4 or more prescription drugs. And that's on a regular, continuous basis. So half of adults 65 and older are taking a significant amount of medications. And honestly, there are a lot that take more than that. And if you go up in age, that number tends to only increase.
Yikes. I almost feel like it's a fountain of youth, but I feel like I know we'll probably get into it, so tell me to put a pin in it, but when you take medication, I feel like there's always some sort of side effect. There's always some sort of side effect. So you're fixing this thing, and then you have this thing, and then you take another medicine for this thing, and you get that thing. Can you just treat the symptom and the problem? But I'm pretty sure that's probably what you're going to talk about today. I haven't seen the script. It's always good for us to surprise each other, so that way we're in your shoes as a listener, because we don't know about our own fields. Okay, cool. So that was our first segment.
That was our segment for today.
Okay, so are we only doing one segment today? Okay. All right, so explain to us, what is a pill burden?
So when we talk about pill burden, so that's a way that we talk about the amount of medications, specifically the amount of chronic medications that the average American takes on a daily basis. So not just the occasional as needed medication, which, I mean, that can be part of it as well, but the medications that we take on a consistent consistent day to treat our chronic conditions, our symptoms, our medical problems.
In other words, we have to use these, take these, or we die.
And not necessarily die, but definitely contributes to symptoms. So sometimes we take medications for symptoms. Sometimes we take medications to better manage our chronic conditions. Sometimes it decreases our risk of certain things like heart disease. Sometimes it helps us to manage our blood sugars, our blood pressure, and sometimes it's for pain control, treatment of cancer. So there can be a lot of different reasons why people take these medications.
Gotcha. And when we say polypharmacy, that's just multiple medicine, multiple prescriptions, right?
Yeah, there are a lot of different definitions. So polypharmacy, in the simplest sense of the term, would be taking multiple medications. But there are different definitions. Some people believe polypharmacy is 5 or more medications. Another definition would be taking an excess, so taking more medications than are actually needed. So I think in this country, a lot of people feel that we overprescribe, that we're over-treating symptoms, and we are risking potential side effects and other problems by just adding another medication to the list without really thinking about it and evaluating first.
Gotcha. So you say others think. What do you think? I mean, you're on the front lines. You worked directly. I feel like traditional medicine, this is why we're doing this podcast. We're trying to move away from traditional medicine, which is overprescribed. Like, what do you think about that? Do you agree that overprescription is a thing? And are you incentivized? Like, what's behind the curtain? Would you tell folks that are listening around prescriptions and how to be wary of some of that?
I think polypharmacy is a big problem that we do truly need to address, especially in older populations, in our elderly population, our elderly patients, that something that people don't really consider. And a lot of doctors will consider this, but when you get older, your organs aren't functioning as well to be able to metabolize these medications. So your kidneys and your liver, they're the two main organs that will break down the medications or, and toxins or other substances in your system, but they're not working as efficiently. So medications are just more prone to building up at higher levels when you're older in age, because your kidneys just aren't getting rid of it as quickly as they would when you're younger, when everything's working the way it should be.
Got it. So we talk about kidney and liver function. I would imagine that's the risks, but are there other risks?
Well, the risks of polypharmacy really are medication toxicity. So if you think about medications, especially the ones that can be sedating, so medications that we use for anxiety, for mood disorders that can be sedating. And
you are on anxiety I'm sure you don't want your business out there, but let's be real. Like, you're on anxiety medicine. So what does that do for you as a risk?
And not all of them. So, medications like SSRIs or SNRIs, which are classic first-line medications that we use to treat anxiety and depression right now in mainstream traditional medicine, they're not necessarily sedating. Some of them certainly can be, but the ones that are more concerning are going to be your benzodiazepines, like your Xanax and your Valiums, also your mood stabilizers that we use more for bipolar disorder or schizophrenia or schizoaffective disorder. Even when we have dementia, patients with dementia who have more psychosis, so they have hallucinations and more agitation, and sometimes the medications that are used to treat those potentially will treat those symptoms, but they also can cause some sedating, some cognitive effects. And when you think about the people that we're treating, so obviously dementia is is something that we typically see in older patients. And these are the patients that are at higher risk of not being able to metabolize those medications, then those are the people that we primarily use those medications and are at highest risk of the side effects.
Got it. That makes sense. So, like, what would be the alternative? Like, if you have high anxiety, you take the Xanax or the Valium, whatever, or the other things. Some people can't sleep, so you take Ambien or whatever it is. Like, do you recommend for people just to deal with their anxiety, or or does it depend? Like, what would you recommend?
No, we never want people just to deal with their emotional and their depression, their anxiety. We don't want them to just deal with it and not help them, because that can also be devastating. That can also be problematic. But I think trying to offset the use of medication, not necessarily completely avoiding it, but focusing on lifestyle and not just pulling the trigger every time somebody has a symptom and saying, we need to treat this with the medication.
Right.
I think we need to ask more questions and do more of a cost-benefit analysis, which is more up your alley.
You sound like me. I said cost-benefit analysis so much around you. Are you starting to use my words?
Maybe.
Oh, jeez.
But think
That's
about
some sexy talk right there. That's that financial talk. Whoop, whoop.
But think about the risks, think about the benefits, and really weigh those before adding another medication to the long list.
I'm sorry to pause you. I'm trying to do better about that. I just get excited. But there's something you said I really want to hit on. I know the next question's coming. But if you only have 10 to 15 minutes per patient and you're constantly behind, you got patient notes and paperwork, and you do all the admin stuff in this office. Like, I'm pretty sure that's not common, but in this office, you did everything. How do you dig down and help the patient? By the way, guys, this is why she exited. Looking at my camera here, this is Laurie, Betty, Karen. We named it after our moms. Phil, and Russ. By the way, I'm wearing this Canadian tuxedo, and it definitely adds about 20 pounds to me. I look pretty jolly in the video. Anyway, I'm looking at Laurie here, and it's difficult. It's really, really difficult, because how can you make a difference when you're expected to churn and burn patients and keep going, 10 minutes, 15 minutes. You haven't used the restroom. We talk about this all in episode 1. Like, most doctors are so tired, they just write the prescription and move on. Not all the time, but that's probably a lot of the times what they're doing.
And that's part of the problem, and why I think we kind of have that reflex to prescribe medications, maybe add to that long list of medications, because we do really want to help. And sometimes people do want to get that magic bullet. They just want something to take the symptom away, and maybe aren't necessarily wanting to put in the huge effort to be able to really figure out what the root cause of the problem is, or to significantly change lifestyle. I think a lot of people are interested in making some adjustments, but we just don't have the time. And a lot of us want the time to be able to really dig deep, and especially if it's a new patient, talking about everything that came before, and what is truly contributing to these symptoms. What can we do to change it? And it takes time. It's something that it's not an automatic switch that you can flip to make things better. And so that's part of the thing too, is that if somebody comes into you and their blood pressure is through the roof, their blood sugar is through the roof, it takes some time to be able to give that education. A lot of times you're having to bring the patient back frequently so that you can really give them that education, and you can work with them to figure out what the real problem is. But you also don't want them walking around with blood pressure that puts them into stroke range, or puts them, if they're, obviously having chest pain, or if they're having something that puts them at risk of having something dangerous happen, you want to be able to kind of dampen down some of those issues that they're having.
Right. And that makes sense where you use, medicine or whatever. Well, I know that you are certified in obesity medicine. So how does the polypharmacy in obesity medicine, like with weight gain or weight loss, or impact your overall health?
So, like you mentioned initially, the medications can all have potential side effects. So we talked about some of these antidepressants or anxiety medications, the antipsychotics, the ones that we use more for like mood stabilization or agitation or psychosis. And a major side effect of a lot of these medications is weight gain or metabolic syndrome. And so that's another reason that you really have to think, is this medication really necessary? And when we look at our list of medications that we use, really considering what are the side effects, which of these medications poses a higher risk of causing weight gain or metabolic syndrome. And sometimes, as people who have taken depression or anxiety medications in the past, a lot of times those first multiple medications that you try are ineffective, and you finally find one that really works well for you, and you have that potential side effect, but the alternative is, having major psychiatric issues that are life limiting, and your functional status is limited to the point where that medication is really helping you improve your life. And so you have to consider how to kind of offset those side effects and prevent a whole other realm of side effects that include, potentially increasing their blood pressure, increasing their weight, that will increase their risk of having diabetes or heart disease in the future. So you really have to think critically. And I think another problem with this system where you're seeing patients frequently, and sometimes you're seeing a patient, they're moving to a different doctor, they're moving out of state, and they come in with this list of medications, and that list of medications, you don't know if something was just started, if the person that started them on that medication before truly thought about what the potential risks, what the benefits were. Are you just going to continue those medications? I mean, you really have to do what we call a medication reconciliation when you get a new patient to really start from scratch and say, like, which of these medications are truly needed, which are potentially causing side effects,
A good doctor does that, though.
But that's the problem of our system right now, is that there's just not a lot of time.
Right. And when you spend more time with patients, so if you're working 80 hours a week, I know this is a harsh conversation, but if you're working 80 hours a week, which is very common, do you have time to go through and reconcile medicines? Or do you want to take that time with your family, with your personal health? You're a human being too, And that was a huge balance. That was hard. I've seen it. Like we lived it. It's very difficult where you didn't have time for me. You didn't have time for yourself. You didn't have time for your family, your friends. It wasn't cutting the mustard. You know what I mean? So anyway, I'm digressing a bit, but I think that's important as, people listening, they're sensitive to the fact that most of their doctors are probably going through something like that. And you can argue, yeah, they make money. Oh, yeah, but at the end of the day, they're human beings. They're doing the best that they can. And it's good to understand and just say, hey, I want a medicine reconciliation. When you go to a new doctor, or we've been seeing a doctor for a while, it's like, do I really need to take all these medicines? So that brings me to my next question. How can you minimize this? And we talk about medicine reconciliation. That's one way.
Yeah, you really do have to start from the basics and start from the beginning with your new patients, and learn about their health history, learn about the barriers that they've had in the past, kind of learn the pattern and why. Especially, I think it should raise a red flag in younger patients, and by younger I'm saying even like 40-year-old, 50-year-old, 60-year-old patients. If they're on a ton of medications, like, we need to be talking about, when were these medications started? Why were they started? Are they actually taking those medications? Because a lot of times things that we see too are patients that feel embarrassed to say, yes, this doctor started me on these 3 different blood pressure medications or these 4 different blood pressure medications, but I'm only really taking one of them because
Right.
3 of them cause side effects. But I'm afraid to say that I'm not actually taking my medications as my doctor recommended that I take them. And that's why my blood pressure is still high, not because I'm taking all 4 of these and for some reason my blood pressure is still high and I can't explain why. And so you have to build that trust with somebody so that they feel comfortable with saying, well, I didn't feel comfortable taking these medications, or I read about the side effects and I felt like the side effects were not worth the potential benefits.
Right. Yeah, because I think that hits home with me because, as you guys know, I may have mentioned this before, is, I'm still carrying around 25 pounds. Yeah, I lost 60, I was 65 pounds I gained in COVID, and I gained, I'm trying to lose this 25 pounds. And I was just like, let me see a weight loss specialist because I'm working out a lot still. I'm older. I'll be real, but I ran 5 miles this morning. I worked about 4 to 5 times, very high intensity. My diet is probably not the best where it needs to be. Probably not getting much sleep. My stress levels are probably higher than they probably should be, but I just needed some help to control my appetites and my cravings. So I was really interested in what a obesity medicine doctor would offer and what would prescribe. And they just give you a whole list of things and they tell you all about the side effects. And I'm like, I don't like these side effects. I don't like some is constipation, some would really dry out your skin, all of that. So yeah, I think that's really important to understand the side effects and making sure, like what is the major thing. Unless it's life-threatening, then maybe you probably could go without it. I've been in that scenario and my doctor's really cool. Actually, I said, well, what is side effects? I'm more of a naturalist. And he said, well, sometimes you're not playing with all 52 cards. Is it 52 cards or 52 cards? Yeah. Mm-hmm. So we talk about this a lot, and obviously we will honor patient confidentiality. Like, would you recommend patients like weaning themselves off their medications? I know that people say, I just stopped taking it. You know what I mean?
Definitely not. And that's where having a doctor that you trust comes into play, because most of my patients will feel comfortable with saying, I didn't feel, I'm going to be honest with you, doc, I didn't start this medication last time because XYZ, and that's when you really have to ask why, because sometimes it's cost. Sometimes the pharmacy didn't have it in stock, which is something that we're really struggling with now with all medications. It's not just these weight loss medications or some of the highly coveted.
What's driving that, do you think?
I don't know. I don't know if it's the post-COVID supply and demand or really what is going on, but it's even blood pressure medications and certain types of cholesterol medications. I mean, I've really seen it all. Where pharmacies will reach back out and say, we don't have this in stock and we're not going to be able to get it back in stock for several days, and this patient has completely run out of their medications. What would you recommend? Is there something else that we can start them on? And so that's a problem. Sometimes
I almost feel like people should store a separate bottle somewhere just in case they run out as a stock, just in case it is life-threatening.
Well, that's where insurance comes in too, because insurance is only going to allow you to fill.
That's right.
They're not going to allow you to fill something early and pay for it.
Right.
And so you can't really stockpile unless you're not actually taking your medication.
Right.
And the other things you have to consider too are, some of these patients who have had older providers in the past that have retired that might not have updated their medication list. There are a lot of newer medications that we use now, and specifically for management of diabetes. In the past, the mainstay might have been things like glipizide, a certain type of diabetes medication that can cause some weight gain. There's a risk of low blood sugars, so we try not to use it especially in our older patients. Sometimes it can cause your pancreas to burn out because basically it's stimulating your pancreas to put out more insulin. And if you're a type 2 diabetic, you're insulin resistant. And if you have high insulin resistance, then it's it's kind of a hamster wheel until the pancreas just burns out, and then you actually have to have insulin to be able to survive. And so there are these new medications like the Ozempics and like the Mounjaros and Trulicity, these injectable medications that can not only help manage blood sugar, but it can also help people lose weight and maybe help them come off of a lot of their other medications too. And so if you have a patient that comes in that sees you and they're on all these older medications, then sometimes it's worth having that discussion about changing to something new and trying to even cut back on those medications with the goal to, if you're losing weight, even peel back blood pressure medications.
Right.
Even a 5% weight loss, which is not a whole lot, can positively impact your blood pressure and your blood sugars. And we talk about this a lot, improving the gut microbiome, using lifestyle, food as medicine, exercise, really educating patients on those adaptive lifestyle changes that can also help them slowly peel off of medications. But you should do that under the supervision of your doctor. You should never just stop a medication without having a plan, a game plan.
Yeah. And you talked about the microbiome. So if someone could get more information, what would you recommend for that? I think that's a big buzzword right now.
Yeah, so I did create a free ebook that gives you more information about why the gut microbiome is important. And we're learning more and more that it is not only important in just your gut health, what you would consider your, having normal bowel movements and, improving abdominal bloating and pain, but can also impact your whole body inflammation, which impacts insulin resistance and metabolic syndrome. It can impact your mood, depression, anxiety, your immune system. And so by starting there and resetting your gut, sometimes you'll find that everything else kind of falls into place, or at least some things will fall into place.
Yeah. Which we affectionately call it your gut garden.
Yes.
And that's part of like what our health is about. So we focus on obesity medicine, which is not just weight loss, guys. So I don't want to put a connotation with weight loss. It's being healthy in the body that you have, and not. We have a community out there that watches our show and is a big fan of ours. We're a big fan of theirs. One of a dear friend of mine, and they're big on no body shaming. We believe in all that. I believe in all that, right? But I do believe that there is an opportunity for health as it relates to weight loss clinically, right? With your blood pressure, blood sugar. We talk about functional medicine quite a bit, which is food as medicine, gut microbiome. Today is more of the internist pillar, I would say, more the primary care physician. So we try to rotate these topics. So let us know what you guys think about these topics. We want to dive deeper here. If there's something that she said that you just don't understand, we're replying to every single email right now because we are, we're smaller and we're growing. So if someone follows all the advice of their doctor and they're on these medications, they said 55% of elders are on 5 or more medicines. I just can't believe that. I just can't fathom that. But if they wanted to get off these medicines, what do they do?
Yeah, and something that we really focus on or learn in obesity medicine would be minimizing what we consider obesogenic medication. So it's not just what I mentioned already, the mood medications, like the antidepressants, the anti-anxiety medications. There are some heart medications like beta blockers that can sometimes contribute to weight gain. There are some people who have nerve pain. There are medications that can improve nerve pain, but also impact weight gain. And sometimes it's more the sedating effects. Sometimes it's other things that contribute. But if you're able to talk with your doctor and transition off of those to really help with your weight management goals. And you mentioned, the body positivity movement. I don't think people should be hyper focused on the number on the scale. They shouldn't be hyper focused on that BMI as a cutoff.
Yeah.
And I always tell my patients, because I went to the University of Florida when Tim Tebow was there, and I remember in my nutrition classes at the time, they would always talk about Tim Tebow technically was morbidly obese because his BMI.
I've been morbidly obese for 10, 15 years. I'm 6'6", 275 pounds. My heaviest, I was 315, which I probably was morbidly obese then. I'm 240 at my height. Very, very, very lean. They still said I was obese. So yeah, I'm a offender of that. And the thing is, with your work, side story, I know, but this is kind of funny. With your work, you do the tests and you do the health assessment for the dollars. And I did that, and I was coded as morbidly obese, and they would call me every week. And then I was like, okay, what are your goals? Weight loss? Like, no, not really. I mean, and this is when I was like 240, 250. I was pretty solid then. My body fat was like probably less than like probably 10% or whatever. That's when I really cared about stuff like that. You get married and you nest, you don't really care about stuff like that as much.
Yeah.
My wife thinks I'm sexy, especially in my Canadian tuxedo. Anyway, I'm digressing, but this is important. They would call me every single week, and then they would talk, and then they was like, well, have you lost any weight? And I said, no. Well, what are your eating habits like? I said, well, I do 12 egg whites in the morning. I do my meal prep. I do a protein. I do green vegetables and all that. They're like, well, do you think you can get some more exercise in? I said, I work out about an hour, 2 hours a day. This is like a while ago, guys. And I'm just like, and they call me every single week to get them damn dollars. And they're doing that because I'm morbidly obese.
And
it's kind of bullshit.
Yeah. If you think about it, it's just the way that we calculate BMI is just based on your weight and your height.
Right.
And if you have a lot of muscle mass, muscle weighs more than fat, and it's going to increase your weight, but your height stays the same. And so that's going to increase your BMI. And so you really have to, it's kind of an okay screening tool, because especially if you're considering our American population, most people who are in that range above 30 it's going to be an unhealthy, 30
Yeah,
plus.
and that's fair.
But you have to know that when you have, and I've had plenty of patients that came in where their BMI was over 30 or 35, but they were bodybuilders or they were athletes, and you really have to take that into consideration. And the flip side of that, people who might not necessarily be solid muscle, but they still have an elevated BMI. It matters more what your fitness level is. If you're very physically active, if you have good cardiopulmonary fitness, but you still have that high BMI, you're technically at lower risk of mortality or lower risk of heart disease than someone who's a normal weight that is not physically active, that's more of the skinny fat, or people who have a normal BMI, who technically have a body that they might look like they're lean or skinny, but they have a lot of more visceral fat. So it's more hidden
inside,
fat that's thought to be the more metabolically active fat that produces those cytokines or chemicals that cause inflammation and make you more prone to insulin resistance and some of these biomarkers of metabolic disease.
Yeah. Well, I took it down a rabbit hole. My bad, but that was important because I think it does make sense as these medications you're talking about. A lot of side effects are weight gain, which is not fun, and then you have to take the other medicine because you have gained weight. And so, all right, so walk me through the journey again. Like, what do you do to get off these medicines if these medicines are not? Someone doesn't want to take 5-6 medicines a day.
Yeah. And the other thing too that you have to think about is the dosing of the medications and frequency. These medications, some of these blood pressure medications, technically to be effective, you're supposed to take them 4 times a day.
Jeez.
Which often we don't do more than 3 times a day, but they're less effective that way. And I don't know about you, but I don't know how often I would actually be able to take a medication 3 times a day, every single day, without life getting in the way or forgetting to take medications. And so you really have to individualize things with your patients by saying what makes more sense for them with their busy lifestyle. How are we going to get to a shared goal? Because sometimes a doctor's goal is not the same as the patient's goal. The patient might have a goal of being able to walk their daughter down the aisle at the wedding, not getting their weight below a certain threshold so that their BMI is less than 25 or less than
Right.
30. So you have to have that discussion. But, and I would say too, before starting someone on a medication, you need to think about the implications of those side effects and the weight gain. But if you're trying to get people off of the medication, you really have to start slowly decreasing doses of certain medications while maybe adding something that would be better for them in the long run, with a plan to completely wean off of those other medications.
Yeah.
And I think lifestyle, we'd mentioned that a lot before, but really having a long discussion about lifestyle factors, exercise, what they're eating, and coming up with a plan that works best for them in that aspect too, so that it's a slow process. I'm not saying people are going to be able to stop all of their chronic medications at once,
Right.
but knowing
But
that
it can be done, is what you're saying.
I've
in
been
most
able,
cases.
Yeah, I've been able to get people off of medications, and specifically for my diabetic patients, type 2 diabetes, who are on these obesogenic diabetes medications that might be helping temporarily lower their blood sugar or keep their blood sugar within range, but it's just packing on weight, insulin, the glipizide, the sulfonylureas that I'd mentioned, like glimepiride and glipizide are the two main ones that we use. Those are going to further increase the weight and probably further increase your insulin resistance. And it's just this
Right.
this ongoing problem. Whereas
Yeah.
if you started them on some of these newer medications to help them drop their sugars, drop their weight,
Right.
come off of those medications
Right.
that are contributing to weight gain.
I wonder if this is an interesting thought, and this is totally on brand for us. I wonder if in the future, based upon interest, like, would people be interested in doing a medical reconciliation consultation? That's something that we could probably do for people, honestly.
Yeah.
That's right in our brand. You settle time with us. We evaluate, well, not we, MD over here evaluates your medicine. We don't replace your primary care doctor. You got to make sure that they're in line, but we can help ultimately maybe wean you off of those medications in a healthy way, but with stipulations that you got to do what we say. You know what I mean?
Yeah.
But people probably are motivated, and I think getting a second opinion is so important. Like, you may have a doctor for a while, you may love them, and the best example I can give from a wealth perspective is I have a friend of mine I've done 5 or 6 different real estate transactions with, but every time he writes me a proposal, I take that to a competitor or to a neighboring bank, and I say, listen, this is what he's offering. Can you beat it? One time I had someone beat it. He was not happy because, but I told him, I said, listen, this is business, think personal. I always go to you first. And if you can beat it, let's go. I think it's the same damn thing with health. I think people should be entitled and allowed to have relevant and quality information like this. I think medicine reconciliation and simplifying your medications is a powerful thing, and it's totally in line with functional medicine. I bet you there's a bunch of things we can do with that.
Well, I can't tell you how many times I've had a patient come in where we do this medication reconciliation and they're having symptoms or they're having problems, and I look through their medication list and I say, well, this could be a potential side effect of this medication. And they're like, oh, well, nobody told me that could be a side effect, or I had no idea, or things are outdated on their med list where it's the wrong dose, or they haven't taken that medication in a while, or they're taking these other medications that they didn't think were relevant. And so it makes it very hard to manage when not only are they taking all of these medications, but they're also taking all of these potential supplements and herbals and over-the-counter treatments that you don't necessarily know about that could also be contributing to some of their issues. And so it really, as I mentioned before, time is so important. Having the amount, and you don't necessarily need that much time every single visit, but having enough time up front, or if someone's having a lot of issues, or if someone's really complex and they're on a lot of medications. And something that I didn't mention too, they've done studies to show that the more medications someone's on, the higher risk they have for being hospitalized, their higher mortality risk. And I know some of that could be because the more medications you're on, the probably more health problems that you have. But there are also so many more complications, especially if you're on, opiates or controlled medications, controlled substances that can impact your breathing and impact your mental status. That can certainly land a lot of people in the hospital if they have drug toxicities or overdoses.
Yeah. So I know we talk about medicine reconciliation. So is there a way to do this naturally? Like, could you do it with food? Could you do it with supplements? Is there a way that you can actually look at that? And if someone wanted to get more information about that, how would you guide them on that?
So a lot of the chronic conditions really stem from, I would say, metabolic syndrome and inflammation in our country. A lot of it is the diet that we eat, the stressful lives we live, the toxins that we're exposed to every day, the sedentary lifestyle. Genetics do play a role. And I've had plenty of patients that come into me that do all the right things. They live such a healthy lifestyle, but their blood pressure is still high. Sometimes it really is genetics, and sometimes you might have to be on a blood pressure medication for that reason.
Which is probably not what people want to hear, but I mean, that's
I
just
would
reality.
say that's probably the exception to the rule. I would say more people, if you really want to be a purist or you want to be as natural as possible, the best thing that you can do is really get the amount of sleep that you're supposed to get every night, manage your stress, eat the diet, a whole foods diet, avoid ultra processed foods, move more, be more physically active, and both a combination of cardiovascular exercise, cardio, and weight training and resistance training. Doing all of those things together, if you're diligent about it, a lot of times you'll be able to significantly reduce the pill burden or completely eliminate the pill burden in some cases. And I think modern medicine is an amazing thing where we do a great job of treating acute illnesses. So when people come into the hospital, if we need to do surgery, if we need to stabilize people, people who had heart attacks years and years ago, it was a death sentence. Now you can live a full life, and we have not only technology to help with that, to help bring you back from a catastrophic event like that, but also medications that can help. So I don't want to say that all medications are bad, but I do think that piling medication after medication and not really evaluating why someone was started on something or what life circumstances are contributing, I think you can really minimize the amount of medications people are on.
Yeah.
And to talk about supplements, herbal supplements, it's just a slippery slope because I think you can potentially get a lot of benefits just from the foods that you eat. And these supplements, as I'd mentioned in prior episodes, they're not FDA regulated. If you're going to choose a supplement, you want to go with a company that maybe has a quality standards. They have a governing body that really will focus on the quality of those supplements and make sure that there aren't contaminants and make sure that they actually have what they say are in the actual pill bottle. But even then, there are plenty of herbs that we can find out in the wild that can be dangerous, that can be poisonous. I mean, there are plenty of poisonous herbs, things that can negatively impact your health too. So just because something is purported as being natural and herbal does not mean it's necessarily good for you.
Right, like nerd alert. So I'm super big fan of this. So the Avatar, The Last Airbender, I'm totally losing people with this. But if you are watching and you are an Avatar anime person like I am, it's probably my favorite. I've watched that more times than Game of Thrones, which is saying something. They're dropping a live action, I think, next week. I'm super excited about it. But it reminds me of Uncle Iroh. when they run off and they're bandits. We should probably watch that tonight. And he's doing like a bit where he's trying to figure out, like, tea is this thing, and people watch the episode or the TV show, they know. He's trying to figure out, like, hey, is this poisonous or is this tea? And he's like, I'm gonna try it, and it's poisonous. He said, well, is this poisonous or is it going to heal me? And then Zuko's like, we got to find a doctor. We're not taking any more chances with these plants. I don't know why that popped in my brain when you were talking about that.
But it's something that I think there's a misconception if it's on the shelves, if it's at a health food store, if it's in a supplement bottle, that it's got to be regulated. It's got to be safe to take. And that is certainly not the case. There have been plenty of people who've had liver failure and kidney failure from taking some of these supplements.
That's right.
And I think a good resource, there's an app and a website called About Herbs that was created by Memorial Sloan Kettering, which is a famous cancer center, that has a list of a lot of the most famous supplements or herbal, herbs or herbal supplements that you could take. And it has a breakdown of not only...
And we're not sponsored by them, by the way.
We're not. But it's something that I used in practice, something that can be helpful if I had a patient that said, I'm taking this. And a lot of times you've never heard of it before.
Mm-hmm.
And they ask, are there any risks with taking this? Can it potentially help? Is it something that's going to interact with the medications that I'm on? And it really has a great database that shows you what are the clinical studies that they've done to show, is this actually clinically helpful? What are things that it's used for?
I didn't know that.
What are side effects? What are potential, and they have case studies too of people. It might not be a high number of people who've had issues, but it also talks about medication interactions. And so that is something that everybody has access to. It has a clinician's section. It also has the consumer section. So it kind of goes more in depth for the providers that are reading it. And gives a little bit more in layman's terms for the consumer. But I think that's a good start if you're a little bit curious.
Yeah. Well, this is what I would say to people. So if you are listening to this podcast and you are hearing this about a medicine reconciliation, drop us a line. Ask us a question. Like, let us know. Is it your parents, your grandparents? Is it you that you probably wouldn't want to understand the medicine reconciliation? I mean, right now that we are a little smaller, so if you are watching this a year or 2 years from now, we don't know where this journey is going to go. This probably won't apply, but we want to hear from you guys. Is this something that you are interested in doing? So we're trying to figure out over time, like, what product and services can we offer folks? Not to taint this, because this will always be free information. We really want to help people, but what other things can we do to supplement this podcast for people to take quality information to better their health? So what would you say to people who should own their health?
I mean, I think it should be a shared responsibility.
But where's the onus more on?
Well, we're shifting into, I think, a time when patients are really taking responsibility for their own health and are doing their own research. And there's a divide too. There are some people that don't have that health literacy, where they don't have access to information. And so they're really dependent on their clinician to make those decisions for them. I've had patients who are like, you're the doctor, just tell me what to do and I'll do it. Whereas now you have a lot more people who are active in that journey.
What would you say to those people? I feel like that's not, people say the same thing about financial advisors and CFA. I had a conversation with my friend this past week. Well, I just get to my financial advisor. I said, well, do they have mutual funds? Or do they have ETFs? Are they charging a fee? Are they charging a fee for this? What's going on? What's your rate of return? Like, ooh, I'm like, why? Why, guys? Why? There's two areas. This is what, like, I do agree that it's shared. I think it's two areas that people should always be a steward of: health and wealth. You should own these two things.
And you have to have access to that information
you
too.
Do.
There are people that don't have the access.
By listening to us.
And then they feel more comfortable. You just have to hope and pray that they have a clinician
That's true.
that will guide them in the right direction.
That's true. But the thing is, it's science. It's not perfect. It's. I don't say it's an art. Is that offensive if I say it's art?
I think medicine it's an art and a science. There's a lot of gray area. There's a lot of style that goes into it. There are a lot of opinions. I know we have a lot of research and randomized control trial studies that are supposed to be the gold standard, but you also have to to know how to use that information and make it applicable to your patients, because everybody's different.
That's right.
I don't think that you can use, as I've mentioned before, you can't use a cookie cutter approach to medicine anymore.
Right.
Everybody's different.
That's right. Everyone's different, but I do think there are common principles that can be employed, like what you just discussed. Like, are you moving? Are you eating healthy food, non-processed food? Are you sleeping? Are you keeping your stress levels down? These things are not easy. Like, we haven't figured it out. I mean, we may be doing well in the fitness area, and then all of a sudden we're not sleeping like we should, or our stress levels high.
Consistency. I think.
Yeah,
I think
hard to keep in balance.
And stress
though.
level too. And we're in a time in our economy, or obviously in our life right now. I'm not working full time, looking for jobs.
Yeah.
Not having that routine really throws you off of your A game.
Yeah, and we talked about the economy, inflation, minimum wage in our last episode. So if y'all did not get that, definitely catch that. It was a different format than we've ever done, and it's very controversial. Our most controversial episode, a lot of F-bombs. It wasn't us. It was
not for young ears.
Yes, it was not. It was not. Okay. Well, anything else you want to leave the audience with?
No, we touched on it. I think a partnership is key, and lifestyle is key. You really have to scrutinize the information that you see on the internet, because anyone and everyone is going to tell you what they think is right. And some people have so much confidence, but they don't have the knowledge or expertise to really back it. And so you just really have to be careful with who you get your information from.
You do. But I am confident in this podcast that you will get quality information that should empower you to make better decisions for your health and wealth. That I am confident, because we are practitioners, we are believers, we live this, breathe this, sleep this.
We do.
Okay. Well, until next time, guys, thank you for joining today. Hopefully that was informative for you guys. A little health,
A little wealth,
and a lot of love. Bye, guys.
He's on the hustle, she's on the grind. There's no time to kill. For saving lives and new deadlines, and there's some holes to fill. With a little health and a little wealth and a lot of love. That's a life that we live. Suits and scrubs.